Yes, so I'm here together with Morten, just besides me here. And just a very brief introduction of myself. I'm a professor in veterinary microbiology at the University of Copenhagen. I've been working with infectious endometritis for quite some time. Morten and I partnered up more than 10 years ago, 15 years ago probably, and have done a lot of studies on this, both in terms of research, but also with a lot of students that has passed through our labs. And I'll let you introduce yourself, Morten.
My name is Morten Petersen, and I've worked with reproduction in horses for the last 25 years and did some initial work in Denmark, went to the US, went back and did a PhD, and then joined up with Mickey and his team at the microbiology lab. And it's been very fruitful to dive into the world of bacteria in the uterus, but we'll share some of the data with you later.
So the way we plan to do it is that we will give a presentation, and I will start with some of the more basic concepts, and then Morten will end off with some more clinical concepts and insights into what we have done over the years. So I'll just try to share. So as Martin announced early on, we will do a sort of fairly wide webinar focused on the problem mare and how to focus on the problem mare and how to deal with these latent uterine infections. So there's quite a number of different issues we will try to deal with. I'll start out very basic, so all of you will have insight into the equine or the mare reproductive tract. We know that there's a normal microbiota in the lower reproductive tract, so it's normal to encounter bacteria and other microorganisms here in the green area. We also know that there are some natural barriers, so the vulva, the vulva-vestibulum junction, and also the cervix, obviously, that is keeping the normal microbiota out of the uterus. That's at least how we like to think about it, especially some years back. What you probably also know, most of you at least, is that hemolytic streptococci are the most frequently isolated bacteria in relation to endometritis, so sort of an infection in the upper reproductive tract. This has been shown over and over again. It's very large investigations with thousands of mares have shown that hemolytic strep are the most common cause of endometritis. There's a lot of other bacteria and a lot of other fungi, for instance, yeast, that can cause infection. But the most common and the most dominating infection is hemolytic strep. One of the things that we have looked a lot into is how do these infections actually start and how do they establish in the uterine lining. And what you see here, I hope you can see my pointer, I've just superimposed the uterine mucosa or the here. And what you see is up here that you have free planktonic bacteria that can enter into the uterine environment. Some of them are able to establish a sort of a superficial infection or establish a microcolony. This is what happens over here. The bacteria start to produce this yellow formation. This is a substance that they can make that is quite sticky. And this is actually where you see the biofilm formation starting. This is something that most bacteria can do. A lot of clinicians talk about biofilm as something special. This is actually not so special. This is something most bacteria use to establish a microcolony basically anywhere on your teeth or in the uterine lining or anywhere else that where they stick to the surface and make a colony. Later that biofilm develops, so the bacteria divide, most of them at least, while making more of this sticky substance here. And some of them, because it gets such a big colony, the oxygen level starts to decline in the old part of it, and you see formation of what we call low metabolic cells, low metabolic bacteria or persisters. These I will get back to in a minute. But what happens then next is that the biofilm, the mature biofilm, starts to release bacteria again, and then they can sort of enter into the same circuit and colonize other parts of the uterine lining. This is how it all starts. Some bacteria are able to attach. The red parts here are specific fimbriae, for instance, specific entities that bind specifically to the uterine mucosa. This is not all bacteria that are able to do this, so there are differences between different bacteria. What we have looked into is how the streptococci actually colonize in the endometrium and also get their way into the tissue. So what you can see here is the uterine lumen. You have the mucosa here, you have the rest of the complex endometrium here, and you have a crypt here. If we magnify that a little bit, you can see the crypt cut through here in an enlarged, and you can also see a quite clear signal. This is when we use bacterium or streptococcal specific visualization methods. So these are all these clearly shining white and bluish things here are bacteria that are in the crypt. If you look at other parts of the endometrium, so subepithelial, you also see a lot of signal here, and that you can see easier over here. A lot of bacteria sitting quite deep in the tissue. So not on the surface, but actually in the tissue. And this makes a difference. Now we have sort of shifted away from the initial establishment of a biofilm and then to bacteria that are streptococci that are established in the tissue, quite deep in the tissue. What we have also done is to, because how can that actually happen? We have made the cell cultures with epithelial cells, and we have seen that the streptococci are able to communicate with the epithelial cells and actually make sure that they take them up. You can see another picture here. They actually make like a cup-like structure, and the bacteria are taken up by the epithelial cells. And later, this is from an inside picture inside the epithelial cell. You can see the cell nucleus here, and you can see all the streptococci, and you can probably also see that they lie in a sort of a compartment within the cell. And this is a very important picture, this one, because it shows that the bacteria can survive inside the cells. And this is a very good way of surviving on a long-term status where they are hidden from the immune system and can stay there for quite some time. So what we have shown and others have shown too is that streptococci can be positioned quite deep in the tissue. We have shown that they have a low metabolic lifestyle or form these persister cells. They can survive intercellularly, so they can actually escape the immune system and stay for quite some time. You can also see it so this is a cartoon. Most of the persister cells or those low metabolic streptococci are basically asleep or dormant, as we say, and then sometimes due to different signals, they can wake up and initiate a known infection as we know it from the regular streptococci. Another way of visualizing this is what does it actually mean? Because if they are active growing the bacteria, they are quite easy to grow on agar plates. This is what you see when you do your swabs or other ways of showing the presence of the bacteria. But if they are inactive or these dormant cells, dormant bacteria or persisters, they are basically not doing anything. So all growth associated diagnostic methods, so swabs, culture from biopsies, culture from lavage, for instance, will show that they are negative. They will not come up with a growth. This is quite important because most of the diagnostic methods are actually based on growth depending methods. Another very important point from this is that the active bacteria are sensitive to penicillin, for instance. We basically never, and I can almost never say that the active streptococci are sensitive to penicillin, just regular penicillin. Whereas if they are in this dormant state or the sleeping state, then they tolerate basically all kinds of antibiotics very well. They tolerate very high levels because most antibiotics work by inhibiting the metabolic rate of the bacteria, but because that's so low already, there's not really much to inhibit, and because of that, they tolerate. And probably a lot of you will experience, if you use bActivate, that you have used it on, or that the mares that you treat have been treated several times with antibiotics. So you sort of cannot imagine that they have living bacteria inside the tissue, but this is actually the case due to this reason. Just a little bit about how we see the latent infection develops. So here you see 3 different horses. This is 3 different stages, basically. What is clear from the first green horse is the young breeding mare. But what is also clear is that from what I showed in the first place, that they have normal microbiota, they have normal streptococci in the lower reproductive tract. And whenever you breed the barrier, these barriers like the cervix into the inner, the uterine part of the reproductive tract, then you have a spillover of bacteria that potentially can infect the uterus. So this happens if you have natural cover, if you inseminate the mare, or if it foals. So every time you breed the cervix, you will have an exposure to hemolytic streptococci and other bacteria, of course. When you do that, some of them will establish. This will not affect the reproductive efficiency really, but they will start establishing the infection. When all other parameters of the breeding mare are good and well, then this will not affect fertility. But then in the end, when you get to a certain age, as Martin already talked about, 12 years or more, if there has been 3 foals or more, then you have breached the barrier quite a few times. Or if you've had complications like endometritis, abortion, and the like, then you start to see problems kicking in. So this is really sort of an evolution where you have this latent infection establishes very, very early, we believe, and then it sort of evolves over time and starts to create problems when we see that the mares have passed 12 years, 3 foals, or have had other complications. And then I will pass the word to Morten, who will go more into the more clinical parts.
Thank you, Me. And I'd like to start out with a basic terminology approach, because this is latent infections are not that commonly described, but we have decided to use the term latent infection because we are dealing with a chronic infection, as Miki mentioned, that has been established over years. It's a subclinical infection, and when we look at it, it's also an infection that can be sleeping or dormant. When we did the initial work demonstrating that the bacteria was localized within the tissue, we also found out that the bacteria was multifocal distributed within the uterus. So you could find a little bit here, a little bit here, a little bit here. But going through the dictionaries, we found out that if you have an asymptomatic infection that is capable of showing symptoms under some circumstances, or if activated, it's termed a latent infection. And this protocol that is illustrated on this timeline is what we have established over the years. And it's quite simple. You start looking at the mare when the mare is in early estrus. It can be just with a slight uterine edema and a growing follicle. And at that point, you take your initial uterine culture. And that can be done using different regimes. We recommend low volume lavage because that has the highest sensitivity. Following the initial sample, you install the 10 mils of bActivate. And bActivate is a freeze-dried formulation, and along with the freeze-dried powder, you get 10 mils of saline. You resuspend the bActivate like you would resuspend a vaccine, and make sure that it's shaken well so that it's a homogeneous solution. And then you install it in the uterus like you would install, say, treatment with antibiotics. Then you come back 2 days later and do the next culture, what we call a post-activation culture. So now you have 2 cultures before and after the bActivate. And with the initial culture, you can get an idea about what is the status of the uterus before activation. And on the second culture, you will know what's after the activation. Not a common scenario is For example, you isolate E. coli on the initial sample and then Streptococci on the second sample. But even though that you isolated, say, a medium growth of E. coli, for example, on the initial sample, you can be in a situation where there's no E. coli on the second sample. But you know that there's E. coli there and there's Streptococci there. And when you know which bacteria are present, you can determine which antimicrobial to use. And then you decide based on the pre and post activation sample which antibiotics to use for your local treatment, for your treatment in the uterus. But because you had bacteria activated, you know that you have bacteria within the uterine endometrium. And we have identified bacteria up to 1 millimeter into the tissue. And you will never reach those bacteria if you only treat them locally. So you need to treat them systemically. And for the beta hemolytic streptococci, we recommend penicillin. So a treatment with penicillin twice a day, standard dose for 3 days. And that's very effective for the antimicrobials, for the bacteria. And because they are actively dividing, they're extremely sensitive to penicillin, for example. I want to share with you some of the initial work that we did where we demonstrated that it was not a contamination of the uterus that took place, but an activation of the bacteria present. So we either installed PBS, which was the carrier, or bActivate, and then we came back 48 hours later, so 2 days later. And these are some of the images that we recovered of the culture plates just to demonstrate how different response to bActivate that you can see. If we start out to the left with mare number 7, if you see the pointer here, this is the 0-hour sample, so just before bActivate. And then when we came back 2 days later, we could identify a moderate number of bacteria. If we look at mare number 8, there's no bacteria before activation and there's no bacteria after activation. On the picture to the right, there's a mare number 3, no bacteria initially, but heavy growth of these classic beta hemolytic streptococci 2 days later, and no growth on mare number 4. And if we look at the data, if we look at the mares that received bActivate, out of these in total 34 mares, 17 grew Streptococci and 17 did not. Whereas if we look at the PBS mares, there was 12 of those mares, only one of them grew Streptococci and 11 did not. And if we do some statistics on this, it's a very significant finding that it's an activation that takes place and not a contamination. And this is one of the first studies to demonstrate that it was actually activation that took place in vivo. We also did another study where we looked for neutrophils, so polymorph neutrophils within the endometrium in the mares that was then activated. And if we look at those mares that we found PMNs in, so neutrophils in, when we evaluated the tissue, it was a total of 8 mares, but of these 8 mares, 7 of them activated. If we looked at the mares that had no PMNs, there was a total of 11, but there was only 3 of the 11 that activated and 8 that did not. Again, a significant finding demonstrating that presence of the PMNs is an indicator of a dormant infection, the latent infection, but also that you can have the presence of the PMNs without an activation, but predominantly the PMNs as an indicator. So what have we learned over the years? These latent infection is a result of wear and tear. So as mentioned, it's if we look at problem mares, so mares defined as poor breeders, not pregnant despite 3 covers or more, we find that 80% within this group have a latent infection. And these are mares that are either 12 years of age, have had 3 foals or more, or have a history, for example, of a positive culture. We have looked at through the years looked at a variety of horse breeds, warm bloods, jumpers, dressage horses, standardbreds, thoroughbreds, quarter horses, even some of the not that large breeds. It could be the Icelandic horses. It could be some of the pony breeds. We have found these latent infections in all of these different types of horses. It's very classic that bacteria and the host evolution have an evolution that sticks together, and this is a very good example of that. I want to share with you some of the results on activation and fertility. These are some data from Irish stud farm, thoroughbred stud farm that was very well managed with very focused on detail. A total of 19 mares was activated, and 2 days later we came back and cultured them again, and 16 of these 19 mares were culture positive. The mares were then treated and bred in the next 2 cycles, and out of these 16 mares, in total of 14 got pregnant and 2 did not. This was a stud farm that was a very large stud farm and had a very good data keeping system. And in the same year, they published some retrospective data looking at data from 888 mares that were either barren, slipped, or rested. And within that group of mares, they had a 61% pregnancy rate per cycle and a 19.3% fetal loss rate. And within these 19 mares that was evaluated over a couple of years, we had a pregnancy rate per cycle of, and that can be compared directly to the 61% that was the average on this farm. The fetal loss rate in these 19 mares was 13 versus the 19%. But what was one of the most striking things was the reproductive efficiency. So on average, 1.4 cycle was used to establish a pregnancy following activation, whereas the regular treatment that was used, it was 6.3 cycle per pregnancy on average. So in conclusion, we can show that the latent endometritis is a highly frequent situation in the selected group of problem mares. The latent endometritis is due to the dormant beta-hemolytic streptococci, and activation combined with treatment, making the bacteria susceptible to the antibiotics, increases fertility and increases the reproductive efficiency. There's a lot of people that have been involved over the years, initially a group from Denmark and the US, but over the years we have also done work in Australia and South America and different places in Europe. So we are very happy to have collaborated with a variety of people. I'd like to thank you for your attention, and we're very happy to answer questions.
Thank you. We have a question from Stefan in the chat, but I could start you guys up with asking, does bActivate in any way affect the immune system?
In a way, it does. I mean, it's the most important thing is that it sort of reignites bacterial growth, and when you do that, so bActivate is actually provoking a uterine infection based on bacteria that are already there. So they are sort of undetected by the immune system while they are there as a dormant infection or latent infection. But then we use bActivate and reactivates them. And then the immune system can also help. They cannot do it on the immune system cannot do it on its own. It will often require treatment with antibiotics. But it will make sure that the immune system is helping out on clearing up this.
And the next one would be Streptococci. What is the difference between an active and a dormant Streptococci?
So as I tried to explain, it's I mean, normally what you know, as you all have diagnosed hemolytic streptococci, and they grow readily from I mean, within 24 hours you will see nice growth, not very big colonies, but still easily detectable growth. When they are in this dormant state, they basically don't grow, or they grow very slowly. So What we have seen is that if you take samples and you leave them for like 3-4 days, then you can actually sometimes see very small colonies, or sometimes you don't see any colonies at all. So it's a very slow growth, or it's not. They are not growing at all.
Morten, could you read up Stefan's question?
Yes, I'll be happy to do that and answer as well. The question is, would you use bActivate for mares who you will flush for embryo transfer? And we have experience with that. Yes, you can do that. The thing to decide is that to allocate a cycle for activation and treatment, and then you can activate, treat, and then short cycle. And we have several cases of donors that were heavily infected because they have been flushed, and even though that you do whatever you can to do it as clean as possible, it's inevitable that you will bring bacteria into the lumen of the uterus, and if you do that in diasters, it's a extremely culture environment for the bacteria. So I recall a very young Icelandic mare that we activated that was only been used for embryo transfer, and it was heavily infected. So yes, for sure. And just to comment on what Miki said, because initially when we worked with these mares, we worked with mares that we knew had dormant infection, and we wanted to identify, say, what bacteria is it, what is the specific molecular and phenotypic signature of these bacteria. So we activated the mare cycle by cycle, and just the activation by itself was not at all enough to clear the treatment. You need to treat with antibiotics when they're active.
Then there's another question about, do you know how many % of the mares that will stay clear after having been activated? This is something we don't have a lot of data on. We know though that most mares will be clean for some time. I mean, for at least one season, maybe more seasons. It all comes back to there's a lot of factors that sort of govern whether the mare is easy to pick up an infection or not. So if you have poor conformation, for instance, it's easier pick up a new infection. But the answer to the question is that we cannot really tell you, but we can definitely say that they stay clean for at least a season, usually. Some of them more seasons. We've seen some of these very heavily infected mares that had both 2 and 3 foals after without any complications.
And I can take the next question. What is your protocol for antimicrobial use after bActivate and sensitivity results? Do you combine systemic local treatment, and for how long? That's a very relevant question. We say if you have a situation where you would like to treat the presence of gram-negative and gram-positive bacteria within the uterus, you select antibiotics that you would normally use for such a combination. It could be, say, a combination of aminoglycosides and penicillin, for example. That would be the the local choice, and treatment with lavage followed by antimicrobial deposition once a day for 3 days. And that goes along with the systemic treatment with penicillin twice a day for these 3 days, just the regular dose with 22,000 units per kilo. Just like the regular dose of PPG or procaine penicillin that you would normally use.
Are there any meeting attendee that has tried to use our product bActivate and would like to share a story how it went? I would love to hear from you.
both good and maybe less good.
Yeah, both good and bad. And then I can ask you guys a little question. If you were a stud farm manager at a high value mare farm, when would you introduce bActivate to mares that started to show?
I can tip in on that. It depends a lot on the situation that you're in. If you're in a situation where you want to get the mare pregnant as fast as possible, then I would use bActivate to get a status, because then you know, is there any dormant bacteria there or not? Is there a latent infection or not? And then you can treat it if it's present, and if there's no bacteria present, you can proceed and breed in the next cycle. Then you skip having to try out and maybe not getting the mare pregnant initially.
If I can add to that, we have experienced some, now we have been on the market for quite some time, and some of those that started out using bActivate early on, they were, everyone starting up sort of a little bit, it takes a while before they get used to use the product. And many will start doing sort of the regular diagnostics and see how that goes, even though they may have a mare that sort of fits all these risk criteria that we have listed up here. Our suggestion, and what is usually picked up by most that have used bActivate for a few years, is that they start with bActivate if the mare fit these criteria. Because what you must realize is that it's very likely maybe around 80% of these mares will have an infection like that. And you don't clear it if you just do diagnostics. Maybe you will not even get to a point where you know whether it's likely that it's infected or not. And even if you did so, then you would need to clear it by some way. And you cannot do that by just treating once more. So a good way of getting to this problem is to use bActivate quite early in this in your diagnostic setup, in order to address it as quickly as possible and not spend time and resources on finding no answers, basically.
Morten, I know that you did a smaller study with a local where you introduced bActivate quite early in the mares showing difficulties in getting in foal. Could you share a little bit what that was all about?
Sure. It was a study with a Danish vet that was at a relatively large thoroughbred farm, and we wanted to evaluate the status of mares that were not pregnant following the first breeding foaling. So you can say that it's a group of mares that have not been selected in any way as hard as you would when you talk about these problem mares. And within that group of mares, 50% of them were activation positive. And for me, it underlines the introduction that Miki made, that as the mare gets older, as the mare works as a brood mare, is bred and foals out, the uterus is contaminated, and over time these dormant infection establishes. And if you look at the very selected poor breeders, the problem mares, you will find 80%. If you look at mares that are not as selected when it comes to reproductive efficiency, then you'll find around 50%. So it's a way, these data says that the bacteria are out there, and the more fertility problems you have, the larger the risk that they will carry these infections.
Then there's a question in relation to comparing diagnostic methods, low volume lavage, swab, or biopsy culturing when you have activated. So this post-activation culturing.
Yeah,
I think it's we have actually looked into this. We didn't find a statistical difference, but it was close. in the way that, like we see without activation, we see that the swab is less efficient, quite a lot less efficient than the low volume lavage and biopsy. But it depends a little bit on how heavily infected the mares are. If they're very heavily infected, then it doesn't matter. You can use whichever. If they are less heavily infected, then you would need to have more success by turning to the more sensitive diagnostics like lavage or biopsy.
I had one time a vet that used our product, and after activation, yeast was found. Can you comment a bit on that?
Yeah, maybe one thing that is quite important to consider is that some of these mares, some of these problems mares, have been in this problematic situation for years maybe, and have been treated a lot. We have also had mares in that have been in an ET program, for instance, and have been treated several times with antimicrobials, been flossed several times, which means that the uterine environment is not normal, you can say. They are basically also, the immune system is not functioning completely normal. So this also means you will see that in these situations, basically anything can establish. That could be yeast, it could be other bacteria that are not commonly associated with endometritis. And this, so what we recommend is that you try to clear that up. That's usually a superficial infection, and then you activate afterwards. Then you will very often see that there's an underlying streptococcal infection. And this is only when you can really clean it up in particular. I think this also goes to the next question, whether bActivate can only activate streptococci. We know that streptococci are very clearly activated. So you can also see increased growth by after activation by other bacteria, as Morten talked about, E. coli. And we've actually seen a whole range of other bacteria starting to grow after activation. But if you get sort of an unspecific growth, maybe different types of bacteria, it's probably because there's an underlying factor that you have the streptococci more deep in the tissue. So again, this is where we recommend that you clean up the superficial infection first, and then you do a second round of activation where you very often will see a lot of streptococci being activated from the tissue. So this is basically what we recommend to do.
And just a comment in general, I would say that it's 95% of the mares that are activated that will grow streptococci. So that is by far the dominant bacteria that you will activate, but you can also activate other bacteria.
Yeah. At least in the first, at the first shot. What we actually tend to believe, having looked at a very big amount of data, is that E. coli, for instance, which is sort of considered as one of the second most frequent causes of endometritis, is not very often the primary cause. We often see that if you have an E. coli infection, it's quite superficial usually. You also see that most E. coli infections do not result in inflush of neutrophils, for instance, in the tissue. And they're only there because you have a sort of a local immune suppression due to the streptococcal infection. So very often when you see yeast, E. coli, other bacteria superficially, you can culture them, then you find streptococci deep in the tissue.
Thank you.
Welcome.
And do we have any other questions? Are there anybody that would like to share a story when using bActivate? Now's the time.
But I can just say that people are very welcome to either write us an email or call us. They can find the phone number on our website, and we'll be happy to discuss the specific mares with you and talk about the different options that we see.
We can also, maybe you will talk about that as well, Martin, but there's also quite a lot of material, podcasts and so forth on the homepage. So
yeah, we have tons of information, studies, and also I did a couple of podcasts with you guys that are quite interesting. And also the beta of our studies is on bActivate.eu, and go check that out. It's vital information. And if you want to have that problem in foal and increase your chances, bActivate is definitely a product that you should look into. I dropped in the chat previously that where you can order our good product, and we surely hope that you do so and have a good experience. And you are more than welcome to connect with us if you have any questions on how to use or any other things. Do you guys have anything to add?
Not really.
No, it's very relevant questions. Thank you for that.
Yeah, and thank you for the questions. I would consider this webinar to be finished up.
Have a good evening.
You're welcome.